Objectives. List the early signs and symptoms of dementia. List some gradual cognitive declines noticed in patients with dementia. Explain what triggers the onset of this memory disorder. Which symptoms from the early, middle, and late stage deficits contribute to a diagnosis of dementia? List and explain assessment tools for diagnosing someone with dementia, and list some treatment options recommended for patients with dementia.
Key issues of dementia that we would like to point out. Onset of dementia is usually gradual and it may occur at any age, but mostly affects the elderly. Dementia is often irreversible, but some causes that are reversible are subdermal hematoma, tumor, cerebral vasculitis, and hydrocephalus. Behaviors associated with dementia: disorientation, memory loss, disturbed sleep, deterioration in social skills, impulsive sexual advances, and restlessness and agitation. Definite risk factors for dementia include age, family history, APOE4 genotype, Down syndrome, and specific mutations on chromosomes 1, 14, and 21, and also coping resources and mechanisms for both caregivers and patients.
JN is a 70-year-old female who lives alone in a 2-story home. She has 2 children, DW and RS, who have moved out of the state with their families due to their occupation and typically visit annually. Her children called her frequently to check up on her and to see how she was doing. JN spoke to her children every Friday afternoon, and it was something she looked forward to every week. JN is also a regular member at her neighborhood knitting club called the Sweater Ladies. This is where she has spent every Sunday morning for the past 5 years. Even with all the support she has, JN has become increasingly lonely lately due to the loss of her husband to a heart attack less than a year ago. Within the last 3 weeks, she has been forgetting her weekly phone calls with her children. Also, her friends at her knitting club have noticed that she has been coming in looking extremely disheveled and seems to be very disoriented with where she is, which is very unlike her. She no longer comes to the meetings on time, forgets to bring her yarn and needles with her, and forgets to pack herself lunch.
The onset of dementia is usually gradual. It is a chronic, slow, but continuous decline. Common early symptoms include memory problems, difficulty recalling recent events, confusion, reduced concentration, slight behavioral changes, mild depression, and decreasing abilities to do everyday tasks. Some gradual cognitive declines of dementia include disorientation, usually time first, then gradually progresses to place, then person. No recognition of familiar people or self in the mirror. They begin to depend on others for basic activities of daily living. Reduced mobility, use words improperly, sundowning syndrome, aphasia, agnosia, amnesia.
Hi Diane, how are you today? It's good to see you. Have you seen DW? She was supposed to come here an hour ago. DW? What are you talking about? She lives out of state. Oh, you're so right. Silly me. I must have mistaked it.
Damage to brain cells triggers the onset of dementia. The damage interferes with the brain's ability to communicate with other cells, which affects communication, intellect, cognition, behavior, and feelings. Age, neurobiological factors, genetics, and underlying psychiatric or mental disorders all contribute to dementia.
Her friends and children noticed that JN had been acting strange lately, since she had been extremely agitated. One day at knitting, they were making blankets, and everything was going well until JN unexpectedly became very irritated. She began throwing her yarn on the ground while crying. When her friends asked what was wrong, JN just shook her head and began to laugh. The ladies in the group were worried, but figured she was still struggling with the loss of her late husband. In addition, at the next meeting, JN started referring to her late husband and acting as if he was there, even though her friends frequently reminded her that he was not. Her friends decided it might be a good idea to call her children and let them know the recent events, but when they called, her children just attributed everything to their mother losing the love of her life and getting older.
It's okay, Diane. Don't worry. People forget sometimes.
Things only went downhill from there. JN was frequently confused on where she was and who familiar faces around her were. She began slurring her words and had no sense of judgment. One day, her friends went to check on her and found that JN wasn't in her house. They went searching for her and found her down the street, extremely confused. JN said she was on her way to pick up DW from the bus stop and that she was running late. Her friends were able to guide her back to her home and then called her children immediately, telling them that things have increasingly worsened and that they need to come here as soon as they can.
Alzheimer's disease is the most common form of dementia, which has 3 stages. The symptoms of these stages include Stage 1. Repetitive words or actions, trouble remembering names or common objects, gets lost easily, loses things, start of problems with activities of daily living, subtle personality changes, lack of interest in usual activities. Stage 2. Obvious memory problems, confused about recent events, decreased ability to perform activities of daily living, argues easily, appears anxious and depressed, paces, noticeable behavioral difficulties. Stage 3. Fragmented memory, no recognition of familiar people or self in the mirror, uses words improperly, depends on others for activities of daily living, reduced mobility.
Mom! Oh my God! What happened?
Mathematically based memory assessment, or the MCI screen, mental status exams, brain imaging, or MRIs. JN was admitted into the hospital after her children found her lying on the ground. The children explained what has been happening, and the nurse obtained a full history, gathered her vitals, and performed a physical and mental status exam. They performed blood tests and a CAT scan during her stay in the hospital. When JN scored below a 12 on the mental status exam, the nurses began to suspect she might have severe dementia. After the results of all her assessments came back, the physician diagnosed JN with severe dementia and prescribed her medication. The nurse began patient education with both JN and her children to explain her diagnosis, medication regimen, and other factors such as new living arrangements to maintain a safe and independent lifestyle.
So JN, we have some unfortunate news. We are going to diagnose you with dementia.
Dementia is defined as the loss of intellectual abilities that interferes with the patient's usual social or occupational activities. Treatment options available for patients with dementia place the highest priority on helping the patient maintain an optimal level of functioning, including adjusting daily routines to focus on person, adjusting communication strategies, changing reactions to behavior, and adjusting the environment. There is no cure for dementia, but ACE inhibitors have shown efficacy in treatment of some of the symptoms.